just before we start, many of you may have heard of the One Health concept, but I think it's worthwhile just taking a step back and appreciating that, putting big pictures and big concepts like One Health into action is a challenge. It's not always easy. And I just share this cartoon. I'm fond of it, but a lot of different people have to work together. There's different understandings that people can bring, but hopefully where we want to also go, and we really need to recognize the importance of that, is like that gentleman in the back there. He's thinking about actually drinking beer. So trying to make sure that when we have the discussion, when we have the different groups and people working together, that at the end there's still a practical outcome. What is One Health? And forgive me, but I can't give you an easy, simple definition. I'm going to show you a few definitions, but just loosely, this is a diagram from the One Health expert panel from the United Nations, the WHO, the FAO, and the World Organization for Animal Health. And in this diagram, you see some of the key principles or some of the key ideas behind One Health. So obviously you have different sectors working together across different parts of society, different activities, but the end goal being that there are healthy environments, healthy animals, and healthy humans. And again, just to give you a bit more of an introduction, this is the probably the most widely accepted official definition of One Health. As I said, it comes from the One Health quadripartite, which is these four organizations, as I said, the FAO, the United Nations Environmental Programme, the World Health Organization, and the World Organization for Animal Health. I won't read the whole definition, but again, in bold, you can hopefully see that there's a few principles that jump out. We're looking at the health of humans, animals, plants, and ecosystems. That's obviously connected, and it's really about trying to work with multiple sectors and at varying levels to achieve these very important goals. And look, I appreciate that people may say, oh, I've heard this definition of One Health, or that's not what I saw in another place. And, we do acknowledge that there are different definitions for One Health depending on where you go. And again, these are just a few examples, a little bit shorter, not including some of the other things in the previous one, but you can hopefully appreciate there is again that focus on the shared connections between human, animal, and environment and working together. So if there's no single or simple explanation, what we can probably move forward with is that One Health is really a broad concept and is something that relates to issues with human, animal, and environmental health. And within that One Health approach, there are probably some key principles, and there may be more than these four, but just to really highlight, these are four key principles of the One Health approach, particularly when you start applying actual project activities. So obviously prevention is better than cure, and just note we'll actually look at some examples of this as we move through the next couple of slides. So different sectors and disciplines working together. I think I've obviously said that quite a few times already. And the two at the bottom are becoming increasingly important as well. So One Health is recognizing how important it is to work within natural boundaries and ecosystems, and also adopting a systems-based view of the particular problem or the challenge that you're trying to solve. And again, just to try and bring a practical or a bit more of an example, when we are in, practicing One Health or in One Health projects, these are some of the questions that, again, fit with those principles. And again, without reading all of them, important ones is always like, if there's information that we have collected, if we're in the human sector, the animal sector, the environmental sector, who else can benefit from sharing that information? Who else can benefit from sharing resources like vaccines or medicine? What are hidden costs? All these are just a few of the questions that are worth asking to help cultivate a One Health approach. So just to bring it back, the big thing that we want to try and emphasize is that One Health is a broad concept, but allow it to provoke different people to think about how they can tackle or how they can identify and solve problems. And I'll show you that cartoon again. It's again trying to get to that stage where it's a practical focus, just like that guy, is thinking about drinking the beer. We also wanted, our ultimate goal is to try and take all our thinking, all our discussion, and try and have some practical, real beneficial outcomes in environments and communities. So just quickly, I did obviously state that One Health can cover lots of different activities, and sometimes some people can even debate, this isn't One Health or that's One Health. I don't want to get into that today, but I just want to give an example of some general categories that One Health actions might take. So you have integrated operations. This is when different disciplines or agencies work together to get better outcomes. You have an example there where there was joint vaccination of animals and people in sub-Saharan Africa. Another good example is this is a Canadian integrated animal and human health laboratory. So again, sharing of a resource or sharing of delivery of a resource to get better outcomes. Another very important category of One Health projects is in disease management and risk reduction. So adopting a One Health approach often means we are going upstream from a problem. We're trying to actually, in a lot of cases, reduce the disease or even eliminate the disease reservoir. And, this has been used in a lot of, particularly in zoonosis like Brucella, rabies, in different parts of the world where a broader, more integrated One Health approach has allowed the implementation of mitigation measures that really have good or better outcomes when it comes to reducing disease. And probably at its most broad and most recent application, One Health probably historically came out of that zoonosis space. People are appreciating that One Health can actually look at natural ecosystems and how the relationships between humans, animals, and the environment is affecting these natural ecosystems. And in particular, look at what the thresholds, what the limits are for those natural ecosystems. So, we have some different examples there as well, where a project in Cambodia worked to improve not just the health outcomes of communities, but also the environmental outcomes of the place, of the location where these communities live, because those obviously go hand in hand. So this is probably, as I said, it's a more recent direction for One Health, and there are definitely challenges in. And finally, One Health is also very powerful or very important as a political, or in its role for political and strategic advocacy. So understanding those linkages, those connections between humans, animals, and the environment, the One Health approach allows for better decision making, particularly if it can capture hidden costs, identify major risks before they happen. And again, there's a few good examples. We look at projects or studies that have shown the link between deforestation in highland rivers and diseases in humans that are increasing in downstream communities and also affecting local livelihoods like farming. So why do we need One Health? I think obviously as a group, you're not going to be, this isn't a new concept for a lot of you, but there's a lot of major challenges: food safety, antimicrobial resistance, climate change, transboundary animal and plant diseases. With these challenges, these issues, you have impacts and you have solutions that are going to be in more than one sector. So really solving these problems is going to be very difficult. If it's already difficult even if you use any approach, but solving these issues is very difficult if it's just one sector trying to solve it. And here's another quick example. Most recently, obviously we see the huge impact of COVID, and this is just a bit of a funny cartoon, but it is showing that there are these major problems that a lot of our time is going to be spent as to how we address these issues. I just want to quickly also touch on, the cousins of One Health. Now, we're not going to go into detail, but just introduce it because people have asked, and sometimes, yes, there's even confusion. You have concepts like One Health. You may have, and some of you may even be working in or be very familiar with concepts like eco-health, planetary health. Again, these are concepts that have some similarities with One Health, and they also have some important differences. What we want to highlight is, just to be aware of those different concepts. We're not going into detail in them today, but the economic thinking, the good quality economic thinking that you can use for One Health could also be very useful when it comes to things like eco-health and planetary health, particularly when we think about how you bring or how you think about economic value from different sectors and different time frames, how you look at very complex systems and you think about what's the value of intervention, what's the incentive for a behaviour change and so on. So without unpacking, the fine detail of these different concepts, just be aware that they are there. They do also encompass very broad, a broad lens, and some of the thinking that we can do, particularly for the economic side, can be very useful and could potentially be applied in those areas. And finally, One Health is a term that it's been around for a while. There's no doubt about it. In the last, particularly in Southeast Asia, and that's a lot of great work that's been done by the colleagues at Tuhun that deserve credit for making it, a very well-known concept. But there's also a case that in the recent times, some more positive, and we'll come to the challenges of One Health later, but there is now probably an increasing attention on One Health, and what makes it the right time, obviously at the top there you can see that there's a shift now in political, institutional, market thinking. It might not always be explicit with One Health, but things like environmental sustainability, whether that's in consumers, whether that's in businesses, that's very, it's very important now. We also then had COVID-19, which is, that's just a lived example. We don't need to have somebody do a model or do a study to show everyone in the whole world lived through COVID-19. They saw how the health system could not cope. They saw the impacts in tourism. You saw the impacts in farming. Any sector that you think of was affected by COVID-19. So it wasn't just a health problem. And some other things that are important. Obviously, in the environmental side, we definitely need thinking like One Health, because yes, there's big environmental issues there, not just climate change, but in different parts of the world, water and pollution and so on. And perhaps potentially on a more positive note as well, there's the technology now where we have the technology in terms of hardware, so a lot better internet connection all around the world. It's not perfect, of course, but it's just getting better and better. And you look at the phone you have in your pocket now and what it can do. And also the technology of our understanding, or our mental or our scientific understanding of ecosystems, of diseases, of the epidemiology of some diseases. That's, again, it's not perfect. There's lots of gaps, but it's getting better and better. So this is just, a bit of a overview on why this might be an important time, or might be the right time for concepts like One Health. So that's just a broad overview of One Health. We do probably have, if there are any sort of questions, I think we have 5 minutes for some questions, but also remember, we will have lots of feedback, or not feedback, lots of discussion through the course of the day. But please, if anyone in the group has some questions, or they want to make some contribution or statement, we probably have 5 minutes to do that.